So just quickly going through the history, once a microscope was invented and then improved so we could actually see a lot more, like we could see at the cell level, we meaning scientists and doctors, and I'm talking years ago, obviously I wasn't alive then, they started to learn about microcirculation, like capillaries, things like blood clots, things like new formation of blood vessels in tissue. That's called angiogenesis. Angio meaning blood, genesis meaning forming or new. Menchikoff described the different types of white blood cells, which of course has to do with inflammation, way back in 1893. And then in the 19th century, Virchow, he linked inflammation to atherosclerosis. Okay, think about that. As far back as the 19th century, somebody figured this out, but only now are we actually addressing the fundamental core problems here. So as we developed tools in science, the more tools you have to measure different things, the more you learn, right? If all we had was a microscope at this point, we would still be stuck back in the 19th century. Now we have things like gene knockout mice. So they take mice in a lab and they breed them to not have certain genes or to have certain genes, and then they study what happens in that situation. So gene knockout mice laboratory work has allowed us to understand what are called cytokines, which are the little proteins your body produces when there is inflammation. And then that's allowed us to sort of develop our understanding of which white blood cell does what happens to the blood vessels, why do we get warm, why is there swelling, et cetera, et cetera. But I would bring it back to the 19th century again, and Virchow actually questioned back then, well, this inflammation that happens when we get infected or when there's a cut or when there's an injury or something like that, maybe this might not be a good thing for a long time for an organism. So he was very much ahead of the curve. And of course, that was completely ignored forever. And it's still being ignored in a lot of medicine, but we're starting to learn more and more and apply it. So inflammation is a response to pathogens like viruses and bacteria or injury, but it can be hijacked and used against us.